Hello, everyone. I'm Dr. Janelle Jackman, and thank you for joining me today. I'll just give it a minute while Instagram lets you know that I am live and I am on. So, welcome, welcome. Another day with Dr. J. Thank you all for joining me. Let's see. Hello, Charini Mills. Hi, Dr. Banks. So, thank you all for joining me. I know that people are now coming on. I have a really special guest with me today. Very, very excited to introduce her. So, today joining me will be Dr. Adebanke Adebayo. And she is an emergency medicine, doctor. And she works in one of the emergency rooms in a New York City hospital, a hospital that's near and dear to my heart as well, because I worked there before as well. And surprisingly, I learned today that Dr. Adebayo actually is also a nurse. How awesome it is to be both a registered nurse as well as a medical doctor. That was new to me. She's also an entrepreneur. She has her own high fashion design, clothing design clothes called Made with Ife. And it's 100% Nigerian, bringing Nigeria and Africa to the world. And she enjoys traveling. She enjoys medicine, obviously. She's an advocate to residents and fellows all throughout the New York City area, and she does so much to bring good medicine to the patients that she does see. So without further ado, I want to bring on Dr. Adebanke Adebayo. Wait for her request. I know she's on. Adebanke, send a request to join the live because, oh, there we go. The number one thing I didn't mention between my relationship with Adebanke is that she is a personal friend of mine. Hi, Adi, how are you?
Good. How are you?
I'm great. Thank you so much for joining us today and taking time from your busy schedule to do this. So,
Oh, no problem. Anything for you.
how have you been today?
I'm sorry?
How are you today?
I'm good. I'm actually good. Today's a good day. It's my mom's 60th birthday, so
Happy birthday, Mama!
so it's been a good day. Just very grateful for life and good health. So can't complain.
I can't imagine. Do you have anything you want to say before we get started into the questions?
Oh, now we could just dive right in.
Okay. So, many people, when they saw that I was going to do this session, they actually sent me questions of their own on Instagram as well as on WhatsApp, and I just collated all the questions. I tried to group them so that they're not too redundant, but it may happen, okay? So, first and foremost, people want to know what it is like working in the ED at this time.
So this time is way better. I can handle it. But how was it, let's say 20 days ago or even 40 days ago or even 60 days ago? Very, very different.
Right.
Every day was just a different even talking about it now, like I'm shaking, like my legs are jumping. Literally, in emergency medicine, like we tend to think that we're like badasses or, we're just ready for everything. And I don't think your training prepares you for this, but I'm not really sure if your training prepares you for this at this magnitude. Like it just felt like being jumped by patients. Like there were so many patients and you just had to figure out who you needed to save, who needed what at what time. Can this person give you 5 minutes while you quickly intubate and do a central line, which is like a big IV, or put a breathing tube in this person? Can this person wait like 5 more minutes and then you can go to the next patient? It was pretty hectic in that. And then emotionally, it was hard. It was just very, very hard. I know in the beginning of COVID, people talked about like, it didn't affect Black people. And
Right.
so I think that's what made us there was like a delay, and we didn't have the head start that other people had because we didn't think it
Right.
affected us. And so going into work and then watching people that look like me, that look like my mom, that look like my family die or come in gasping for air, it was like heartbreaking. It was just very hard to understand um, the magnitude. And at times, you know, you just want to sit in a corner and cry, but you can't because they actually need you to work.
Right.
So you just have to like separate your emotions from what's going on. And it's just crazy. Like, never ever did, like, teamwork always mattered in our department, but this time
Right.
it really, really mattered. Like, sometimes you work with certain people and you just have to look, you give them a look and they already knew what you were thinking. And it's like, okay, this is the next patient we're going to go resuscitate really quickly.
Wow. So I know you mentioned on how it was having to separate emotions from your actual job, and that obviously is extremely hard because as a human being we're all whole and it's difficult to differentiate. But how were you able to cope and keep up with this emotionally and mentally, even if it's after you left the hospital, without having to bring all this burden at home?
Initially, I don't know, like, I grew up in a family, we're not super affectionate, but you know, I just held in my feelings. And then I had a day where I just couldn't hold them in anymore. It's just
Mm.
like lining up patients from nursing homes, and they were all sick. And these are patients at baseline, couldn't do much for themselves. They're all sick. And I literally felt like I spent the day calling families and letting them know that the person was sick and most likely that they had COVID, and that they, you know, will try everything we can, but I don't know if they're going to make it. And
Right.
there was a day, like, I literally called 10 to 12 families, and without, like, this is not even like on top of the patients that you're like, maybe they can make it, like, we still can buy some time. And I just wanted, like, I just felt the tears coming down my, like, face. And lucky, like, I had goggles on so no one could see, like, my eyes watering up, and I just walked out, and I was just like, this is just really messed up. And it's like I hate to say that statement, but it just felt like this is not fair. It's just not fair. So after that, I realized I can't work like that. I honestly can't work like that. Like, I love what I do, but I can't work with that kind of emotional burden on, like, it became like hard because it also affects your personal life too as well, right? Starting
Definitely.
arguing with people, and every little thing would set me off at home. So for me, like, I have different outlets, right? So the gym is now closed. I can't do that. So music has always been an outlet. So I made sure every
Right.
morning before I went to work that I would listen to music. And I'd pull the residents outside, and then we start dancing, like, at least like making dance videos, just so, because I felt like I'm fortunate. I live with my family, but there are a lot of people that don't live with their families.
That
And
is
so
true.
you're burdened for 12 to 14 hours, and then you go home. It's scary because you're alone with your thoughts. It's not like you
Right.
can have a friend come over and then you can drink, and or, you know,
Talk it
have
out.
a bite and talk it out. You're home by yourself, and that constant, you know, that constant isolation can make someone become really depressed and suicidal. So that was just one of the things that I felt like it was super important. Also, there was a COVID network for physicians and nurses, and so I utilized that, and I was able to talk with someone, and I felt like it was super helpful for me.
Oh, okay. This is something available in the hospital or available nationwide?
It's for New York City physicians. I'll send you the link. We've been repost. I think I put it on my, like, Insta stories. I didn't put it on my actual grid, but definitely you just text them and say, hey, my name is such and such. They'll ask you your profession, and you talk to them, and they'll set you up with a therapist. My therapist is just absolutely amazing because he's not actually trained for disasters, but he's a therapist. And
Right.
so his hours are super flexible because he knows that my hours aren't as flexible. So I can literally talk to him from like 7 a.m. to 11 p.m. So that's pretty
Oh,
wide amount of time.
right. And that's an important point that you mentioned, being able to speak to someone. And I didn't even know that that service was being provided, but I think it's an awesome service because recently I read of a doctor who unfortunately passed away via suicide. And it's very common for physicians to commit suicide. We don't speak about it at all, but it is very prevalent. We are the number one profession, especially female physicians, in terms of suicide. And just having an outlet to avoid this, to have someone to talk to, get your emotions out, I think is a wonderful thing. And once you give me the link, I think I would be posting it as well, so that people know that there are options and there are people to reach out to. So thank you for mentioning that.
You're welcome.
So,
So
as you,
back off of the physician, it's pretty sad because you are a doctor, you're a physician, right? I like to say that I usually don't call myself a doctor. I say I'm a physician because I know I take care of patients. And this woman, every time I hear something about her, people speak so highly of her, like how she was in the forefront, but she just couldn't take the amount of death that she saw, like that surrounded her. And for
right,
me, it's just so sad because why? Like why wasn't there something, like couldn't someone foresee? But then I realized like how overworked, how stressed out everyone was. Like you really don't have time to pick up the little quirks or pick up little changes in behavior on your coworkers because you're constantly seeing death all around you. So you don't really know what it is. And,
right.
it's, you want to be that superhero, but at times I always say I always say this thing at work, a hero sometimes is nothing but a sandwich, because it's true. Like she obviously couldn't cry out for help because everyone saw her as a hero. And
Right.
unfortunately, may her soul rest in peace.
That is true. And sometimes when you're in this position as well, you think because so many people depending on you, you don't want to now in turn feel like you're burdening someone else.
Right.
Yeah, but I want to tell everyone, physicians or not, that there are people that you can reach out to, and we will be providing that link now as it was brought up. It's something that just dawned on me when you said it. So there are different ways to cope, and yours is music, etc., and talking to the therapist. But however you cope, you have to find a way during this time. So in terms of testing, were you ever tested for corona, and how you found that process was?
So it's very different obviously I can write my own order, right? To be tested. Like, yeah, okay. But the testing process, so we were one of the first hospitals in New York City to set up a tent to screen patients, because obviously New York City, a lot of the hospitals were built in the early 1900s. Space is always an issue in New York City, so you couldn't have thousands of patients in your emergency department. So the tent was a good
Right.
way to stifle to separate patients and look through them and see, we could vet patients easily. And so patients would get online. You'd say, I'm here for testing. We'd ask you preliminary questions such as, initially it was if you had fever, sore throat, trouble breathing, comorbidities. And then the questions became, if you had any trouble tasting, trouble smelling, had diarrhea for a prolonged period of time, trouble concentrating, because those all became, as we started to learn, those became more symptoms of COVID.
Wow.
The
Have you
process,
yourself? Mhm.
I'm sorry.
Go ahead. No, sorry.
The
Go ahead.
the process was the hardest part of the process, I guess, was just going through the lines. But and actually getting swabs. So initially we were doing oral swabs. So someone spit into a cup. For me, that was difficult because I don't know how to spit. It's very nasty. And then,
Yes. Agreed.
right, it's really pretty disgusting. And then it became nasal pharyngeal swabs, which is when they put the Q-tip in your nose. And it almost, like, some of the patients describe it as, it feels like you're taking a piece of your brain away.
Yes.
To get the swab. But then so that's been the standard of swabs right now because it has the least amount of false negative rates. And so we've been going with that.
Right. I myself personally was tested about 2 or 3 weeks ago, just because, not because I had any known exposure, but because as a healthcare worker working in New York City, we just wanted to make sure that we're safe. And the test was quite uncomfortable. I didn't think it felt like a brain biopsy, but I think I have like a higher tolerance for things. But it definitely was uncomfortable, but at least, I got my answers from that. So in terms of personal protective equipment, what has been your experience, if you feel comfortable discussing it? Personal protective equipment, if there was a lack of it, if you had sufficient, the reuse.
So I went through the whole H1N1 when I was a nurse. And
Right.
so I realized the N95 mask was pretty important. And so, but we didn't fully don up. So initially when COVID came around, we didn't initially don up. As the numbers climbed, we just walk around the emergency department, and if you were in the area where we saw the patients, we'd wear a mask. That was enough, and that was suffice. And then I realized, as you kept reading more and more, that you needed more than a mask, right? You needed eye protection because this virus can travel. Like the debate was it droplet? Was it airborne? And you're like, okay, so you don't know, I'm going to wear goggles now, right? And then I looked through, because I would post on Instagram on a regular basis through my stories, and it was like the evolution of PPE, right? So first the mask, then the glasses. The glasses turned we wore bonnets. The bonnets went, and then we had the plastic gowns. Then we went to Tyvek suits. Then we had plastic shields for our face on top of the goggles. Right now, my I have a P100 respirator. It looks like the alien mask, people say.
Yeah,
yes, and I have the color coordinating glasses. They're pink too. People don't know who I am, and then I wear my obviously Ankara bonnet, and then on top of that, I wear a Tyvek suit, which we can. It's easier to doff with the Tyvek suit, and which means take it off without touching the contaminated areas. And then it also has a hood on it, so it's like the scariest thing, because you're sick, and then this person with these goggles and this mask standing over you. You barely can hear them, and you're like, am I gonna meet my maker? And it's just like the scary. I would be scared if I was a patient. But for the most part, PPE, at first, no hospital felt like they had enough PPE. Like, no hospital. Any hospital that told you that is lying. And it's not because the hospitals, it's just one of those things, right? You had 1 or 2 patients, and 1 turned to 5, 5 turned to 20, 20 turned to 100. And I will always keep saying that. And 100 turned to 1,000, and it just kept going. So normally when you wear an N95 mask, you only use it for 1 patient. So I wear it. If I'm going to, I'm in room 710, I wear it, I throw it out. When I go to room 711, I put on a new one, right? Because you don't want to cross-contaminate. So the hospitals probably had a month, maybe 2 months supplies. But that's if you're seeing 1 or 2 patients, right? You're not seeing floors of patients, departments full of patients. That supply ran dry really, really quickly. And so that became a problem. The facilities that didn't do refreshers on, donning and doffing, that also became a problem, because you're not going to wear PPE everywhere. So you have to take it off properly. If you take it off incorrectly, then you expose other people and family members to it. So that also became a problem. So no, we didn't have enough PPE. The government, most hospitals pleaded with the governor. The governor knew during his 12 o'clock briefings, and he talked about it not having enough, and he was confiscating them from whomever he confiscated them from. But it was definitely a concern. You will come into work and, you know, what do we have on the supply list? You
Right.
know, like, are there enough gowns? Are there enough N95 masks? Because the thing about it is people just look at it, right? Because I see people on the street just buying N95 masks. They're supposed to be fit tested, meaning
Yes, fit test.
exactly. So you know exactly, right? When we started
Every year, we used to have to get fit tested
right,
with your big thing, with the spray.
right. Because you gain weight and you lose weight, right? So sometimes your face gets a little chubby, right? And sometimes it gets a little slender. So the masks come in sizes. So people just go out in the street and they buy an N95 mask and they don't know that they're not properly fit tested. So in a proper fit testing, the person is supposed to wear the mask and nothing is supposed to be able to see through it. So there are times, like there was a day that I had on my mask and someone had peppermint or eucalyptus oil and I could smell it. And I was like, oh my God, like I was paranoid because I'm like,
Yeah.
how long has it been like this? Like my mask hasn't been secured. So those are things that the general public really don't understand. They just think that, oh, healthcare workers are being selfish and they want all the N95 masks to themselves. No, we don't.
No.
Like every year we get tortured with that peppery, like it's the peppery, like first they do the sugar, right? So you can taste this and then you start laughing, right? So you can taste it. And then you're like, okay, fine. And then they do the peppery one. If you smell or you can taste the peppery taste, your mask doesn't work adequately.
Yeah.
So that's why they told the public to wear surgical masks. But then they just thought, oh, healthcare workers or essential workers think they're better than everyone. No, it wasn't that. One, you know, there's a method to the madness.
Yeah.
In addition to, right, these are the people that are being exposed on an everyday purpose, right? I mean, on an everyday basis.
Greater magnitude.
Right.
Much greater magnitude of exposure as well.
The grocery store person, they're probably exposed to the same amount. I talked to the person, I went to Aldi, I was online for a good 30 minutes. And I realized that the grocery store worker had seen the same amount of people that I had saw as patients the day before. So I'm like, she's like, she didn't have a mask. And I'm like, why don't you have a mask on? Like all these people getting groceries, some of them are sick, but they just have no one to get groceries for them. And so those were the things that like separated, you know, protective, well, PPE, you know, what kind of PPE you should have and should not have.
Right. And one thing too that I want to send out to the public when wearing PPEs, you have to be very cognizant. I've seen people wearing their mask, first of all, with the mask hanging off their nose. It's not effective if your entire nose is out and you're inhaling the air and someone can still cough on you. Another thing I've seen people do.
No, I can't breathe. That's why.
Like, yeah, that's the point. You want the mask to fit properly. Another thing is the gloves. The gloves make me cringe so much because people wear gloves and they will hold on to the subway pole and they will like press the elevator button and open the door and then they'll fix their hair and like wipe their eyes and touch their phone. And I'm like, it's not a substitute for hands. And honestly, if you're going to do all these things with the gloves, I prefer you use your hands because you're quicker going to sanitize your hand. As opposed to with the glove, you think it's like an immunity blanket, which it really isn't. So this is just, you know, a little bit of tidbit to anyone watching who doesn't know how to put it on properly. Also, you can't take it off holding the front of the mask because that's what would have been covered with bacteria and germs. Try and just unhook it from behind your ear. Don't touch your front shield. These are just all tips, people, because it's easy to contaminate yourself and contaminate others if you use this equipment ineffectively. So moving on from that point.
Oh, the gloves thing, because that's like my number 3 thing I hate about COVID. So you go to Walmart. I went to like initially when it happened, and I was like wondering because I was like, am I behind? Because I didn't have any toilet paper. Like I thought we didn't have any toilet paper. So I like ran to go get. I was like, we're gonna do laundry more often, and I watched this young lady who had everything that you mentioned, right? So the mask is here, the nose is sticking over. And she's on her cell phone with her gloves on and she's walking around. She touches the milk oh, it's 2%. Nope, I want 1%. And she puts the milk back. Then she grabs yogurt. Like, we literally were going through the same aisles. And
Right.
then, you know, the vegetables, the produce, she would touch it with her gloves. Not one time, right, did I see her take off her gloves, sanitize her gloves, because there are people who use their gloves as hands, right? Healthcare workers
Right.
tend to do it. We were like, when people were really, really terrified. So you wear 2 sets of gloves. You wear one as your hands, right? And you
Right.
hand sanitize that, and you wear another one, and you take that one off between patients, like they do in an OR. Some people do that in the OR. And
Right.
she like had, and then, oh, to top it off, the mask is upside down. The metal part is down here, and it's on the white side is outside. So people who wear surgical masks, the colored side is
The
outside,
color side
right?
is off.
The color side is the outside part. Then the metal part is to mold it to, because we all have different nose shapes, hence why some of us women contour our noses and stuff. And then, I'm like not contoured. I was like, Janelle came on looking all fashionable and got me looking like I am here. And then the other thing is, like, as Janelle was saying, when you take it off, you got to take it off from behind your ears and you fold it on itself. And then when you put it back on, you don't touch that side. And so, like,
Right.
everyone's like, why aren't you making Ankara mask? And I'm like, it's fine, right? And then I read a meme where someone said, like, when someone is wearing underwear and jeans and they pass gas, you still smell it on the outside. So you're
Right.
wearing a cloth mask, I sneeze, you know, those particles are going straight through. It's
That
cool
is
to wear
true.
those masks on top of another mask, so you almost have an extra layer of protection, and it helps keep that mask clean for longer for those who have limited supplies to get access to masks. But you should not be wearing them just solely by itself. Like, please, like, it's not good at all.
Right. So as we dive into that, could you like go through your sanitizing process when you come home or your decontamination process?
So that initially was weird, but very quickly, I want to say the beginning of March, end of February, I had a system. So my mom wasn't to come into my car anymore, period, right? Because I needed my car to go to and from work. When I came home, my sneakers, initially my sneakers came, I have like a little vestibule area. It's not a mud
Mhm.
room, but just like a little area. Put my sneakers there, my stethoscope, my ID stayed in the car, my jacket, my work jacket stayed in the car. And then I would just leave the car with just my scrubs on. So it's like winter time, right? Because it's
Right.
obviously we're not hitting spring anytime soon. And then run into the house and then take everything off at the door.
Okay.
And then run to the shower. And my brother one day was just like they peeked through the window and they're like, oh, like Corona's coming, and they would just run into their room. So I would like, they're like peeking, they're like, hey, and they just run. So there's a video like I chased him through the house like with my scrubs on. But for the most part, there's a laundry bag with a garbage bag over it, and then
Right.
I take off everything, drop it there. I'm like, if you're standing there, then you obviously want to see me like naked. So,
So your family knows your process. So they know once you're home, you gotta go inside, or else you're gonna see this
right,
naked body running to the shower.
right, and then you run into the shower, and then I would, and it became a process. You know, wash my hair more often, and like the days that you're exhausted, like, I mean, we've all had those days where you come in and you're
Yeah.
just so exhausted.
Just want to sleep, nothing
You
else.
just want to sleep. You don't have the energy to like take off your sneakers, just sit on the couch. I've had many days I come home from work and I just sleep on the couch. But you can't, like, those, it's now,
No.
you can't afford that. Like, you definitely can't afford not to wash. You can't afford not to sanitize anything that you wear. So like my stethoscope, I try to wipe them down, and my cell phone before, because my cell phone, like many, stays on my bed, you know. It's on my bed, it's easily accessible, so I wipe that down. I've seen people put them in plastic saran wrap and do it, you know, every day. I wipe down the car. I've been pretty lazy with that part, but I'm the only one in my car, so I'm pretty exposed to my own germs.
Right.
um and I just been like taking extreme amounts of vitamins.
Do you isolate from your family at home?
So when I initially, so the way my house is structured, I have 3 floors, a basement, my basement, my first floor, and then I live on the second floor, and I have a bathroom up there. And at first, like I was just like, oh, it's, it's my mom. Like I'm not gonna stay away
Right.
from my mom. And then I started thinking about it, and I was like, oh my God. Like when I started seeing more and more people, and I'm like, oh no, 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 no. So it became at a point where I would just FaceTime my mom in the house to talk to her.
Right.
Like I just went in, and I didn't want to hug her. We'd have hours and hours of talking, but there was none of that. Like
You're right.
and then when I started to feel sick, it was really like scary to me, because it was just like, okay, what am I doing now? So
Right.
that became like more isolation from everyone. Like I wouldn't, if they're in the kitchen, I try to not be in the kitchen with them. I
Right.
didn't wear a mask in the house, but we avoided very, very close contact.
So you kind of did a little social distancing inside your own house.
Which is
And
sad,
that's
but
what you have to do it. And someone actually asked about that. They wanted to know that if you were positive, or for people that are positive, I should say, how do you distance yourself from relatives who live in the same household? And if it is something that you should do. So definitely, yes. If you are corona positive and the rest of your family members aren't, I would say that you should definitely isolate as much. It's very hard. I do understand when you live in the same household. And I mean, it also depends on how many rooms in the house, how many private space you have. But if there is a possibility for you to isolate, I will say isolate, stay in your own space as much as you know. You're going to come to the dining room table, eat unfortunately by yourself if you're corona positive. Also, if you work in a high exposed area, so for example, Dr. Adebayo, she works in the emergency room, you can't get more exposed than that. So if you work in the grocery store or as a pharmacist, so anything where you're interacting with people every day, I think you definitely need to be conscious of the need to isolate. It's not so much just the older people as we once thought. We're realizing anyone, any age, any race, anything could be infected, and definitely you need to take that kind of precautions. Um, Adi, I
well,
want to ask you. Uh-huh.
someone just asked, they said it's hard to isolate from family in the same house. It's true. It's very, very hard. If you're a mother, like you can't, how do you isolate yourself from your child?
Right.
If you're a single mother, then that's just not happening. So those are the people that actually I feel sorry for during this, pandemic, because they have to wash more. They have to
Right.
clean more. You're always worried like your instinct as a mother is to protect your child. So how, like, you isolate makes a difference, right? So someone, like, a question that people tend to ask me is, do you isolate yourself from your significant other? And I always say that's one of those things that I can't tell you what to do, right? Some people, right, with Idris Elba and his wife, people are like,
Right.
why would she quarantine herself with him? And I'm like, that's her husband. Like, what, like, like, isn't that a part of their vows? Like, but I've had people who go into one room, and they say
Right.
that their husband stays in the living room or stays in the bedroom the whole time, and they stay in the living room. And those are the things that help them. But small children, as a parent, I would always tell you, like, there's no way unless you have another family member,
If you have
that
a relative, yeah.
there's no way that you can isolate yourself from children.
Because I know I do have a few patients who do have children, but because of their risk of exposure, they chose to actually have the child stay with their mom or their sister. If you have that luxury, obviously, not everyone would have that option to, have your child stay elsewhere. But if you do have the option, it is definitely something to think about. For me, my personal opinion with respect to significant others, I think if you are COVID positive, stay away from your significant other. But at the same time, if you choose not to, I mean, who am I to tell you what to do? But if you were to ask me for my advice, I will definitely say stay away. It will be a couple weeks, a couple days, a couple months, but at the end of the day, it's, I think, better to decrease exposure. Because one thing I worry, if your significant other doesn't have corona at the time, you have this false perception that I don't have corona. So I'm interacting with my corona positive, boyfriend, and I'm negative. And I'm just thinking I'm negative. So I'm still going out, I'm still going to the grocery, I'm still doing all these things, but yet I'm interaction. So if you're gonna have that interaction, you have to remember that you have to quarantine. If you choose to be with someone who's positive, you have to respect the quarantine.
Right.
So, you know,
And then, I mean, if you're like kissing on a regular basis, right? A lot of the time they might have transmitted it to you as well, right? So
right.
you just stop cold turkey. You're both like, he's positive. That means you should treat as I agree. Treat you're
Right.
positive too until you both go through that period together.
Yes. So someone's asking, so people more or less have kind of been afraid to come to the emergency room for other things, for a heart
Mhm.
attack, for a chest pain, for anything else they have, because everyone's afraid of corona. And I can be honest, I too had my apprehension of going to the emergency room, even when like I felt like, oh, I think I should be tested. I remember I called you. I was like, I think I should be tested, but I don't want to come. So what is your advice to people who have other things, other critical health issues that they may need emergency care for, and then kind of go through the process of how you separate the non-COVID patients in the emergency room?
So what happens is the person that does the triage or the screener is the probably one of the most important members of the emergency department. So you come in and you're telling me, hey, I have abdominal pain. And I say, the screener might say, do you have a fever? Do you have cough, sore throat, anosmia, meaning loss of smell, loss of taste? They ask
Right.
you those questions. If you say yes to any of those, right, you will still be treated, but you go into the area that we might call the hot area or
Okay.
PUI area. So we just call it hot and cold. The hot area is someone you might be concerned with that has corona or has like, as we call it, influenza-like symptoms, right?
Right.
So you go in that area. Then there's also the area where we call cold, right? So I'm
Mhm.
having a heart attack. I had a stroke. I'm not having corona.
Right.
Then you go into another area and we isolate you into different sections of the emergency department. And I think that's citywide where, because irregardless of corona or COVID being around, there's also medicine. And people still have, on a regular basis, the emergency rooms are packed with patients. So it doesn't mean
Right.
now that people are not having appendicitis or ectopic pregnancies
Right.
or, torsion. Like, those things still happen. It's just what I feel now is people are coming in a lot more sick because they
Because
wait.
you're waiting.
You're
Yeah.
so afraid of corona because it's, obviously so many people are dying from it, but you still need to treat that heart attack. You need to come
Right.
and have assistance with that heart attack. So those are the things that make it hard. And so everyone in the hot area everyone in the hospital has on a mask, patient or
Right.
non-patient. It's just the type of mask that you have on. So you're in the hot area, you all have masks on. Some of them don't, some of them have breathing tubes. A lot of them have breathing. So we have we could say warm area, hot area, cold area. The warm area
Right.
is people that I may suspect. The cold area is people that I don't think have COVID. And then the hot area are definitely people that have COVID. And so
Right.
those people end up, so everyone has a mask on. The ones with the breathing tubes, they have filters on their vents. And so that's what helps with keeping the spread down as possible.
Is that social distancing in the hot area or any of the areas, in all the areas?
I mean, it's kind of hard, right? So the
As
thing
much as
about it is,
possible.
yeah, it's kind of hard. Like, I'm with my coworker, we're both working hard, right? Am I going to social distance myself from the person when I have a mask on, I have goggles on, I have a Tyvek suit on? Not really, because I'm in full protective gear, right?
No, I mean for the patients.
No. That's what I'm saying. So then the
Okay.
patients themselves, they wear surgical masks, and then the ones that are tubes, they have they have filters on their ET tubes or their
Right.
breathing tubes. So unfortunately, this is not like the Midwest where our hospital room, like our departments are, huge on acres, they're
Right.
like little buildings that they turn into a department. And so it's hard. The patients, What we have is a lot of HEPA filters, so that's why we can't hear
Right.
anything. So patients think I'm yelling. I just really can't hear you. And, and so that helps with keeping the spread down. And I like constantly tell patients, I know it's frustrating, but while you're here, please keep on your mask. Please, please, please keep on your mask.
Someone wants to know, how do you think a lot of people in New York City contracted the disease? This is from Fumi Fums Lagos.
Hey, Fumi. So how did a lot of people contract it? I think we talked about that a little bit earlier. I think we were very behind, right? So we
Right.
knew that this virus was coming from Wuhan, but everyone was so, concerned with blocking it from coming from Wuhan, not realizing that it actually, we had the first strand come from Wuhan into Seattle, and then a lot of the strands, I think from the testing, was showing that we're getting it from Europe. So we only blocked certain countries. Well, probably in retrospect, or being a Monday morning quarterback, we probably should have stopped traveling, right? Because the first patient that I admitted went to the Dominican, I think he went to the Dominican Republic or something. So,
Right.
and that wasn't even on the radar. They're like, when we asked questions, did you travel? That was one of the beginning questions we asked. Did you travel
Right.
to a known area? I didn't, Dominican Republic was never a known area,
Right.
So,
Still probably is not.
like, wait, what? So those are the things. That's why we fell behind. I think the whole theory behind Black people don't get corona, Black people don't get corona, put us behind by so much, because I remember very carefully like how many weddings I saw that weekend when the world went into like lockdown.
Right.
And it was horrific that week. What changed that week? Like the week before it was bad, but it just went from like a nightmare to like a bloody like a bloodbath, because there were so many patients. And it was the weekend of, I think, the 13th, I want to say. Around
Okay.
that weekend, the school had closed, and that week, like, we saw so many patients, so many patients. I think we saw in 1 month like 2,000 patients in
Oh,
1 month,
wow.
which is unfathomable. Like
Right.
that week, yeah, I think Fumi said the week the 9th to the 13th, we saw a lot of patients then. They closed schools, I think the 16th. That week was bad, but the week after became terrible. People were
Right.
still going to weddings, parties, baby showers, still going out for brunches, still doing hookah, sharing things. It was really, really bad.
I think my personal opinion too, and why, apart from it being delayed, honestly, my personal opinion, and I may get a lot of criticism to say this, I don't think we did enough. And I still don't think we're doing enough in the US, and even more so in New York. So compared to other places in the world, I'm from Trinidad and Tobago, and Trinidad, as soon as like, numbers started to get crazy high in the US, we closed our borders. We implemented like, stricter stay at home kind of guidelines. We have curfew, so you can't go out after a certain period of time, and you're very restricted into where and where you can't go. In New York, I have seen personally, despite our stay at home order, it seems more like a recommendation than a real order. It's like, I think you should stay at home, but if you don't, there's no repercussions. The first week we had that order, I was on my way to work, and that's when I stopped taking, the bus and the train, because that's how I usually travel. And I started to drive to work, which is usually a pain because the city is a lot of traffic to get to, and then
Right.
parking is another issue. But I was like, you know what? It makes more sense. It's safer for me, so I started to drive. And I had my ID on. I had a letter saying that I was essential worker, because I was so mentally prepared that I was going to get stopped for being on the road, because you shouldn't have. And I had to prove that I had the right to get to work. And I passed, I can't even tell you how many police cars, how many people on the road. Traffic was not as bad as usual, but there was still traffic at like 5:30 in the morning. And I'm like, are we really under any sort of thing? And as the time progressed, as the days got warmer, I worked in Columbus Circle, so very close to Central Park. And as the days get warmer, even in March, you saw tons of people in Central Park sunbathing, having fun. Social distancing was a mere recommendation. And, I was like so frustrated, because I'm like, this is not how you deal with a pandemic. in the epicenter of all places. So honestly, I think that in New York, we didn't take as strict as a procedure as we should have or as we could have. And honestly, to date, still, I don't see it because yesterday I left the house. I had to mail something with UPS. I went outside. It was warm yesterday. Once again, tons of people all over. It felt like a regular day. It felt like a weekend. Definitely didn't feel like a Monday, but it felt like, life is as usual. People were outside with and without masks. Some people didn't have it on. It was just so that's my personal thing. And in the US, at least in New York, our borders never closed. Flights still came in, flights still went out. And I can tell you for a fact that though they banned certain areas that were considered hotspot, those people could easily have just traveled to another country nearby and then still enter the US. And they did because I've known people who came from China, who came from Iran, who came from Japan, and they just were able to jump to the nearest country and just fly in. So leaving our borders open to free flights, not having stricter guidelines in terms of what a lockdown looks like, and not having certain regulations, I think that's what also assisted New York becoming such a hotspot, as well as the fact that our subways and buses always remained open as well. And it's very difficult because most people don't drive. So it'll be difficult for even essential workers to reach their place of work if you were to shut down the MTA. But at the same time, to have any and everyone being able to use the MTA where trains are crammed, where a lot of people use it daily, they try to clean it. But I think all of this also assisted to New York being like a big petri dish for coronavirus to just spread. So
I definitely like in so there's so many factors into like that question. You can sit here and answer it for hours. So let's talk
that's
about
true.
let's break this down, right? So Janelle and I are both healthcare workers. Janelle takes the train, I take and intermittently I might take the lure, right? But for the most part, I drive, right? So we're in two different categories now. You take the train, there's no social distancing on trains and buses, right?
Right.
You take the train, people are touching everything. You're hand sanitizing because you know better and you're hand sanitizing. But did we think about the vents in the train, right?
It's true.
Did we think about, right, the trains, how often are they cleaned? Not often as much, not as often as you would like them to be. Why? Because it's a process. You have to stop the subway system, which means stopping the economy. And so that's one of the things that didn't happen. And I've spoken to plenty of people. One of my friends, Tramel Thompson, I have another friend who works for MTA and work for the buses. No one cleans, like they're not cleaning those things, right? So you sit down on it, you're bringing it home. That's one. So now let's talk about the healthcare disparities, right? Diabetics who end up getting it, right? Diabetics, no one social distance, you went to brunches and then all of a sudden now you're a diabetic and you're at
Right.
home. Or let's talk about the people on dialysis who are on it. Dialysis is a life-saving thing. Like it's a life-saving process that needs to happen on, every other day. But now you have COVID, right? So they have dialysis, in dialysis centers, they have COVID days and non-COVID days. But you can't
Yeah.
even be sure, right? Because the bus driver may have it, right? So now people may have it, but I only make $4,000. I only make $2,000 every pay period, or I only make $2,000 a month. My rent is $1,800 and it needs to be paid. So what am I going to do? I don't want to live on the street. So I'm going to go to work. I'm going to take the chance. I'm going to go to work. I'm going to make money for my family. And so I put everyone at risk, right? So I had a headache, little cold, but it's nothing. I go out and bam. Now one person has spread it to 20 people, right?
Right.
Then we didn't lock the borders, right? Because we had plenty of people coming in and out of the country when Corona first started. So people coming in and in addition coming out, like Nigeria closed their border to certain countries, but then eventually closed it to all countries. And that was the way for them to contain it. And I feel like the underdeveloped nations, as they like to refer to the nations that we come from, had a better approach on Corona because
Definitely.
they were like, listen, we can't afford for our population to be wiped out, and we can't afford for our people to be sick like that. So you know
That
what?
is true.
stay in your, like, stay where you belong. Sorry, we're not open for you. And I think that made a big difference. We were so busy, like the leader of our country kept saying it's a Chinese disease. It's not, because Italy was pretty wiped out with it. You look at the countries that had lower rates. So that was like Sweden. Sweden had lower rates. They have better, they have the best healthcare in the world, right? Germany had a lower rate. But that's all because they all figured out, they saw how it destroyed the United States and Italy, and they got smart and they decided, you know what, I am going to close everything, to everyone else. And that made a difference. That made a significant difference in the response, because in New York City, we were so behind, and that cost us, how many people are we? I think we're, how many down?
Over 300. I haven't even kept track recently, to be honest. I stopped watching the numbers.
Right. It's so many. Like, I think we're way over 10,000 deaths in New York. Remember that much. So
Right.
that's what caused it, right?
Well, over 20,000 deaths in New York.
Right.
The
So
last, yeah.
I had to stop. Like, it was getting anxious. Like, I was getting anxious with keeping track of how many. The problem is that, we weren't doing what we should have done when we should have done it. And it cost us a lot of lives. It definitely, in addition to, we don't have a centralized healthcare system, right? So you're in Ohio and you're like, you know what? I want to help. I want to help. By the time you sign up to help, it's like 2 to 3 weeks. And that comes up. So it's just this thing was so multifactorial, but with it, we were all on the wrong end of it. We were being very retroactive instead of proactive in our situations.
Someone wants to know how many cases at your hospital were caused by human exposure or surface contact. Did most people not know how they contacted? I mean, knowing how you got COVID at this stage is almost impossible, especially in New York. Maybe in places where there are 1 or 2 people, they can still do contact tracing. Right now, you could have gotten it. Even Dr. Ade, she works in a hospital. So likely if she were unfortunately to get COVID, she'd assume it's the hospital. But really, we still wouldn't know. It's highly likely. But was it when she stopped at the gas station to pump gas that, the pump that she held had it? Was it from the grocery store? We really don't know at this time. Right now, you just really have to treat it like if everyone has corona and kind of take precautions to that extent, I think, because it's very difficult to know who has and who doesn't. And remember, we're still not routinely testing asymptomatic people. In the early, we didn't really think much of asymptomatic. We thought that most people would have presented with symptoms. Hence, the 14-day quarantine was to give people time, that window period to get symptoms. The 14 days is not even reliable anymore because we know, one, there are way more asymptomatic people than we ever thought about. And 2, 14 days is not enough to clear the virus. And I know that personally because I do know of a couple of people who were infected. And when they were retested at 3 or 4 weeks out, they still were positive. So, it's a work in progress. It doesn't mean that positivity means infectivity. But the point is, nothing in the test actually tells us about whether you're infectious or not. So,
So the other thing, right? So Marita asked, she's one of my sorority sisters that asked the question. You don't really you can't tell, right? Unless you're doing strain testing on, the contact tracing to know how you got it, right? So if you, Janelle and her, Janelle, you and your significant other work in a hospital, you wear PPE all the time, right? And then God forbid, like a family member gets it, you automatically in the bottom of your heart feel like,
it's you.
Oh my God, it's me. Like, I gave it to my family. But sometimes your family member didn't tell you that they went to Walgreens, they went to their friend's house. And so you can never, ever tell how you got it. And it is truly, it doesn't matter, right? You have it. Once you have it, that's another battle that you have to deal with, especially if you get the respiratory component to it. So it's just one of those things that you can't really say. The other question there was the antibody test. Did you do the antibody test, No,
I haven't. I'm probably going to do one sometime.
All right,
I
we'll talk
haven't.
about that. We'll talk about. I did the antibody testing, and I have antibodies for it, and
Which
that's what's gonna make the difference, right? So I have patients fighting me to get COVID testing, and if you explain to them, like they're only testing healthcare workers because they can't go back to work, but the key here is getting the antibody testing, right? The antibody testing will tell you if your immune system saw this as an enemy and it responded to it, and it decided that the next time you get exposed to it, I'm ready to fight for you, right? In layman's terms. So you get blood, they take blood from you, and then the antibody test will tell you you've been exposed to it and or you've had it, right? So it's the two, you can't tell the difference. It just tells you that at that point that you have it and you have the antibodies for it, not have COVID. And so you have some protection. Now the key to antibody testing, right? So similar, it's the same thing that they use with vaccines, is you have to get tested again to see what your levels are to make sure your body still remembers that virus. I feel for right now, your body should remember COVID for a very long time because everywhere is COVID. But they have to figure out how long these antibodies last, because the normal coronavirus, when you get the antibodies, they last for a good amount of time, maybe 3 to 6 months for the regular cold weather, the cold strains, right? So now you need to figure out this one that's just Thanos level. You need to find out how long does your body have protection against it.
Right. And someone's asking too, Danielle, have you treated anyone who's had the corona multiple times? So are you seeing reinfection, in other words?
I wouldn't know. I can't answer that question correctly. I would say that I don't think it's reinfection. I just feel like they've not gotten over it. Right. So there have been patients, they said, this was early on, because people asked me, why do I still wear PPE? Because I still live at home with my family and I care about them.
Right.
And two, this is all new, right? So we don't know if there is actually reinfection. There are people that tested twice, and I think the people that they tested, they said went from positive to negative and then went again to positive. So those things, right, you have to think about, can you get reinfected? I wouldn't know. My point is, like, I see a lot of people that never really, like, I had a friend who had it for over 4 weeks, was dealing with it for 4 weeks. And so when we talk about the 14-day, so everyone wants to know, like, why are we staying in 14 days? Like how you said, it's just not enough time. Like, it's just not enough. If you're diabetic, you're hypertensive, you belong, like, it's going to take, your body's already at immunocompromised state, right? It's going to take you way longer to tackle that virus. And
That
so,
is true.
right. So you think about it, right? A regular diabetic gets a little cut. How long does it, they may lose their foot over a little cut. Talk less of something like this. So it takes a long time. And it was unfortunate because we had to come, like, at certain places, they didn't have enough staff, right? So how many physicians make up less than 1% of the population, right? So you and I are less than 2% of all physicians, right? So the number's getting smaller and smaller. So now both of us are out sick. Like, who, when you go, I've never been to an emergency department and not seen anybody in the emergency department, right? So I don't know what to say, right? So initially it became, the policy was 14 days, even if you had symptoms or did not have symptoms. And then it changed, like, you'd read so every day the DOH and the state sends us like an email. And then it became 7 days. And then it was like 3 days.
3 days after symptoms.
Yes. What?
Yeah. I don't necessarily agree with all the recommendations, but this is what we have to abide with for now.
But I tell them I tell my patients, you don't feel well, you don't go outside. Like, if you need a note, I will give you a note. But if you don't feel well, you need to stay home. And it's not because it's a favoritism thing. It's for the betterment of society that they stay home.
Yeah, and different things have to come into play when we talk about corona testing and corona in general. It's an extremely new strain, so we're learning in the process, and hence things will change as we learn more. So what we say, and when I say we, I mean bodies of medicine, not me personally. But what we say in the beginning may change in 2 weeks if they realize something has changed about it, if they learn something new. We actually have 28 more seconds. So, Adi, we're going to log off and we're going to come back on, okay?
Okay.
So, everyone, just come back on. Instagram is counting me down, okay? I'll see you guys in
All
2
right.
seconds.
All right.
What to log off, though? So come back on. Oh, here it is. And come back on. We'll be back on.